So we're now going into the last section of the lecture and PowerPoint for this week. So we're going to talk about some common joint injuries and diseases. I've started already kind of mentioning some of these things along the way, but we're going to just classify them in general. I'm just going to talk a little bit about these things. So some of them that we're going to talk about are going to be cartilage tears, sprains, dislocations, bursitis, tendonitis, arthritis, and Lyme disease. So cartilage tears are usually due to compression and shear stress, which is like a twisting kind of stress. And sometimes what can happen is that a fragment of the menisci might create like a little flap that will cause the joint to lock sort of in place. Now, cartilage itself is very rarely going to repair itself because remember it is avascular. And so in order to repair cartilage tears, we would, as a healthcare professional, you'd be recommended to a orthopedic surgeon who would go in and repair the cartilage with arthroscopic surgery, which is basically you put like a little tiny camera into the knee joint, and then you have another instrument that is kind of put into the opposite side that you're working on. So you work kind of on this side with the instrument, and then you're holding the camera kind of on this side. Partial menisci removal is going to cause the joint to be less stable, but it's still going to allow mobility. But a complete removal of the meniscus is going to lead to arthritis because now you're eliminating that extra cushion that you had. And now we're talking about two articular surfaces that are going to be rubbing up against each other. Meniscal transplant, it's possible in younger patients, and there is a lot of research studies going on right now in clinical trials where they are basically extracting stem cells and inserting stem cells into this region in hopes that a new meniscus can be grown from these stem cells. So it's kind of what's happening right now in an orthopedic world. So this photo is showing you a tear in the medial meniscus. So here's the articular surface of the tibia, and then here would be the articulating surface of the femur. And here's the meniscus. It should all look like this, but we can see that it's kind of like lumped off here. So this tear would then be excised out in this particular case. So the next type of injury that I'll mention here then are sprains. And sprains are when reinforcing ligaments are either stretched or they're torn. And so this is really common at like the ankle. So if you ever sprained your ankle, it's also common at the knee and finally in the lumbar region of the back. Partial tears of these reinforcing ligaments, they repair themselves very slowly because ligaments are really poorly vascularized. But if there's a complete tear, essentially you have three options. You can either have the ligament sewn back together. The ligament can be replaced with a graft, which is basically you take a tendon from an unused or less used muscle and replace the ligament with the tendon, kind of like in Tommy John surgery. Or the third option is to just allow time and immobilization for healing. And the time factor is kind of the roughest factor of this whole entire process. So sprains happen to ligaments. If you ever heard of the word strain with a T, S-T-R-A-I-N, that's only referring to muscles or tendons, okay? So sprains with a P is ligaments, and strains with a T is tendons and muscles. So I already mentioned to you guys, I showed you that picture earlier of a shoulder dislocation. So dislocations are just when the bones are forced out of their alignment. And a lot of times these are accompanied by sprains, by inflammation, and difficulty moving the joint. They can be caused by very serious falls or contact sports, and they have to be reduced in order to have them in order to be treated. So that means that they have to be actually physically put back in place for a treatment to be successful. Sort of along the lines of dislocation is something called a subluxation. So this is when a joint is partially dislocated, but not entirely dislocated. So it might not move out and stay out of the alignment. It might move out and then come back into alignment. So you're partially dislocated. The next injury is bursitis. And bursitis, so burs is referring to bursa, and itis means inflammation. So this is then just inflammation of the bursa, and it's usually caused by a blow or by friction. Treatment options here would be rest and ice, and if it's severe enough, anti-inflammatory drugs. Like NSAIDs would be prescribed. So some common types of bursitis that I have actually over here are things like subacromial bursitis, and usually this one is due to repetitive activities that cause excess strain on the bursa that's located just underneath the acromion of the scapula. If you have ischial bursitis, this is usually situated at the base of the pelvis, sort of on your butt bone, called your ischial tuberosity. And a pretty common type that's actually seen probably more frequently than you think is called housemaid's knee. And this is where this happens a lot to people that work on their knees a lot, like carpenters or like it's called housemaids because maids, work scrubbing the floors. And the technical term for it is prepatellar bursitis because the bursa that is in between the skin and the patella of the knee becomes inflamed. And then the other type here that I have is olecranon bursitis. And so sometimes this will happen if you fall on your elbow. This will cause inflammation in the bursa that's on the tip of your elbow. And again, this is usually due to like a fall where you've bumped your elbow pretty good. So next, I have listed on here tendinitis. And this is just when the tendon sheaths they become inflamed. And so remember, the tendon sheaths are wrapped by, it's the tendons of whatever muscle that's passing through the joint space. It's where they're wrapped by that bursa-like structure. It was on the same slide as when I introduced bursa to you. So if those tendon sheaths become inflamed, then you get tendinitis, and this is usually an overuse injury. And so in terms of symptoms and also treatment, it's almost identical as bursitis. So for example, tennis elbow is also called lateral epicondylitis because the pain is actually going to be associated on the outside of the elbow. So tennis elbow actually is happening out here on the outside of the elbow. And then golfer's elbow is called medial epicondylitis. And that's going to cause pain on the inside of the elbow, sort of right where your funny bone is. This is going to be golfer's elbow. Excuse me. And that's, again, just where these tendon sheaths, as they're passing through the elbow joint, are becoming inflamed. Okay, So kind of to wrap up our discussion, we'll talk about arthritis and Lyme disease. So there's actually more than 100 different types of inflammatory or degenerative diseases that can cause damage to joints. But arthritis is the most widespread, most crippling disease in the United States. Some symptoms of arthritis are pain, stiffness, and swelling of the joints. Short-term or acute arthritis might be caused by bacteria and can be treated with antibiotics, but there are three major chronic forms that we'll talk a little bit more about in the next couple of slides. So the first type we'll talk about is osteoarthritis, and then we'll talk about rheumatoid arthritis and gouty arthritis. So osteoarthritis is the most common type of arthritis. It is this irreversible, degenerative, wear and tear type of arthritis, and it may be caused by excessive release of enzymes, which tend to break down the articular cartilage. And this cartilage is actually being broken down faster than it's being replaced. So if you kind of remember back to bones, we talked about osteoporosis. This is sort of a similar situation where this time instead of the bone being reabsorbed faster than it's laid down, now we're talking about cartilage being broken down faster than it's replaced. And this can lead to bone spurs, which are called osteophytes, being formed on the thicker ends of bones. And interestingly, by the age of 85, half of the Americans in the U.S. will develop osteoarthritis, and more women, excuse me, than men will develop osteoarthritis because of hormonal reasons. But osteoarthritis, it is part of the normal aging process. And another kind of symptom of this would be something called crepitus. So joints that are stiff can sometimes make this crunching noise, referred to as crepitus, especially upon like standing up. In terms of treating osteoarthritis, really all that's out there is moderate your activity, mild pain relievers, and then some capsaicin creams. Capsaicin is derived from hot pepper, and so it's commonly prescribed to add some temporary relief to joint pain. But things like glucosamine and chondroitin sulfate and nutritional supplements are not really effective against treating osteoarthritis, unfortunately. So there are four, I guess, subcategories of osteoarthritis, and this is kind of the progression at which osteoarthritis would sort of take. So in stage 1 osteoarthritis, there's really minimal disruption, but there is some cartilage loss that's occurring here, and so this is showing in the knee joint. Once you are considered stage 2 osteoarthritis, the joint space begins to narrow, so the space in between the femur and the tibia gets a little bit more narrow, and the cartilage starts to break down, which is kind of what you're seeing here. And in this case, you would also could potentially see some bone spurs happening. Now, as we get to stage 3, there is pretty moderate joint space reduction. So now we can see that the bones are almost touching each other. And the gaps that are actually in the cartilage can expand until they reach the bone. So here in stage 2, we started to see the crack, the breakdown of the cartilage, and now the cartilage is breaking down even further and sort of disintegrating until we're reaching a bone. And then stage 4 osteoarthritis is when we have the joint space is greatly reduced, there essentially is no joint space left, and there is at least 60% of the cartilage is lost, and because of this you will start to see these bone spurs, which are sort of these streak-like structures down here that you kind of see, these really large osteophytes, really large bone spurs. So this is just summarizing the progression that osteoarthritis takes, and just kind of showing you this is where you begin and this is where you kind of end. And at this point at stage 4, really the only treatment option, the best treatment option for you is total replacement. So in this case, it'd be a total knee replacement. So the next type of arthritis that we'll talk about is rheumatoid arthritis. So unlike osteoarthritis, this is not part of the normal aging process. Rheumatoid arthritis is this chronic inflammatory autoimmune disease that really has no cause. We don't understand exactly what causes it at this point, but autoimmune means your immune system, like your own immune system, attacks your own cells because they don't recognize them as being yours. They recognize them as being foreign and decide to attack them just like they would if you were fighting off, say, a bacterial infection. Usually this arises between the ages of 40 and 50 years old, but it could occur at any age, and it actually does affect 3 times as many women as men. So being female makes you more susceptible to rheumatoid arthritis. But some of the signs and symptoms here of rheumatoid arthritis would be things like joint pain and swelling, which is usually bilateral, so it's on both sides of the body, anemia, osteoporosis, muscle weakness, and also cardiovascular problems. And so in this picture, you're seeing a hand that has been deformed by rheumatoid arthritis. So this is a pretty severe case of rheumatoid arthritis here. So just like I went through kind of the progression of osteoarthritis, rheumatoid arthritis is going to begin with inflammation of the synovial membrane of whatever joint is being affected. And the inflammatory blood cells essentially just migrate to that joint, and they release inflammatory chemicals that end up just destroying the tissues. And because of this, synovial fluid is going to start to accumulate. This is going to cause swelling in the joint. And then from here, the synovial membrane that's now inflamed is going to thicken into what's called a pannus tissue. So it just is like a stickier sort of tissue that now is going to cling onto the cartilage of the articulating bones. And pannus tissue unfortunately erodes cartilage, and so the scar tissue is going to form, and scar tissue is going to connect the actual articulating bone ends. So now instead of not necessarily having an attachment at the synovial joint, the ends of the cheekbones are literally being attached by this scar tissue, and this is called ankylosis. So in terms of treatment for rheumatoid arthritis, this includes things like steroidal and non-steroidal anti-inflammatory drugs to decrease pain and inflammation. And also just by disrupting the destruction of joints by the immune system by having the person be on immunosuppressants to slow the autoimmune reaction. And there's also some agents that can target the tumor necrosis factor, TNF, which is a protein, so that actually can block the action of inflammatory chemicals. And then another option with treatment is you can replace the joint with a prosthesis. So do a total joint replacement, whether that be a knee replacement, hip replacement, or so on. So the next type of arthritis, and the final one that we'll talk about in terms of arthritis, is gouty arthritis. And gout is just a form of inflammatory arthritis. And it's characterized by the deposition of these uric acid crystals in the joints and also in the soft tissues that's followed by inflammation. And this one, unlike the other two, is actually more common in men and typically affects the joint that's at the base of the big toe. If it is untreated, the bone ends will fuse together and the joint will be immobilized. But in order to treat gouty arthritis, there are medications, making sure the person is hydrated, and then also avoiding alcohol and foods that are high in purines, like liver, kidney, sardines, that kind of thing. And so gouty arthritis, gout itself used to be called the king's disease because it tended to happen in more wealthy people. And that's because more wealthy people were able to afford the foods that were higher in purines. So that's just a fun fact about gout. Okay, so we talked about arthritis, and then now we're kind of going to wrap up here with Lyme disease. And Lyme disease is caused by bacteria that is transmitted through tick bites. So some of the symptoms of Lyme disease are skin rash, some flu-like symptoms like headache and fever and fatigue, chills, sore throat, muscle aches, that kind of thing. Also, being kind of foggy thinking, so you are kind of fuzzy, you can't really think that clearly. And then also joint pain and arthritis is a very common symptom of Lyme disease. And the way that you treat Lyme disease is just antibiotics for a very, very long time. It's a very long course of antibiotics. And so this little picture is just showing some of the common features of Lyme disease, like hearing loss, paralysis, some heart issues, syncope, which is fainting, and palpitations, which is kind of your heart's fluttering. Dyspnea is feeling out of breath, hot and swollen and painful joints, also having a rash at wherever the tick bite is. And if not treated, it can lead to long-term complications like depression and dementia. In addition, insomnia, so the inability to fall asleep and stay asleep. And then again, as I mentioned, the flu-like symptoms. So this concludes the lecture presentation for the chapter on joints. Again, I apologize that we are having to sort of do it this way, but at least we have the ability and technology to be able, for you to still be able to hear me and hear the lecture rather than trying to learn it on your own. So as I told you guys in my emails, I will keep you up to date as frequently as I can, and we will work through this together. So now that you're done listening to the lecture, make sure that you complete the homework assignments, the 5 questions assignment, and the forum for Module 8. And I will give you some updates on how I'm going to test on it and so on and so forth in the near future. So have a great day, and hopefully I'll see you on campus soon.